Administrating Mr. Underwood's medication. So before I do anything, I will perform hand hygiene and I will start looking at his MAR. So first, I see that he has amoxicillin, and it'll be his oral suspension, and I will grab the cup. Okay, so I'm checking the medication to make sure it is the correct one, and it is. It does say to shake well, so I will shake. And then it asks for a calculation. So I need 500 milligrams, and I have 250 milligrams per 5 milliliters. So I will do that calculation first. Okay, so I get 10 milliliters. So I will check my cup to make sure it is on the right side. I'll shake it one more time, and I will pour 210 at eye level. Okay, there we go, and I will set this one back, and I'll place this on my tray. Next, he needs afloxacin 0.3%, 4 drops in his right ear, so I'll grab that one. I'm checking the order to make sure it is the correct one, and it is. I will place that on my tray with a cotton ball. Next, he needs pilocarpine 4%, 1 drop in his right eye. So I will grab that one. I'm checking this one to make sure it is the correct one, and it is. Place that one on my tray as well. I will grab a cotton ball. Okay, so next, I will prepare his injections. So first, I will prepare the intramuscular one. Okay, so I will grab my injection. Okay, so I need haloperidol lactate, and the order calls for 2.5 milligrams, and I have 5 milligrams per milliliter. So I will do the calculation first. Okay, so it is 0.5 milliliters. Before I do anything, I will sterilize this. Do it for about 5 seconds. Okay, and I will let that sit there, and I will prepare this. Okay, so I will take my cap off, and I wait for it to dry, and I can pour back to 0.5. Okay, and then I will inject, and then flip over and go down to 0.5. Okay, and I will check for bubbles, and I do not have any, and I will scoop the cap back on this one, and I will place it on my tray. Next, I will prepare the insulin. So it calls for NPH 14 units, and I'm checking this one right here. Next, it calls for regular insulin of 6 units, and I have it right here. So 14 plus 6 is 20 units. So I will pull this off and pull this one off, and I will pull back 220 units. Okay, so first I will do NPH, and I will go down to 6. Okay, before I do that, I have to clean this. So let me clean this one. I forgot to clean that one, but I will clean this one. So if I would have done this, I just disregard of this one and grab another one, but I will use the same one. So I'll clean this one, and then I would use a different one, but for the video I will just use the same one, but we are supposed to use a different one. In the same way, circular motions, 5 seconds, and let it dry. And I will do this one more time. So I pull back to 20, and then NPH first, and I would go down to 6. Okay, and then I would do regular and push that down, and I will flip this up and pull down to 6. Okay, put that I'll do the NPH, and now I will go down to 20. Okay, and same way, I check for bubbles, and I do not have any, so I will scoop this up and place it on my tray. So I have Mr. Underwood's medications ready, and now I will get my tray ready. So I have many of these, cotton balls, everything that I need, and I'll place this on my tray. And I'll grab my more, and I will place this here. And I will not forget to document any of these after I go into the room. So, let me grab my calculations. Okay, let's see, my checks, yes, verbalize. And throw these away. Throw this one away. And let me grab some of these for the skin. I'll place this right here. Okay, I don't need my pen. So now I'm on the way to Mr. Underwood's room, and before I walk in, I will recheck my medications one more time. So first I have amoxicillin, and I have my calculation right here of 10 milliliters, and then I have afloxacin 0.3% for 4 drops in his right ear, so that's correct. And then I have pilocarpine 4%, 1 drop in the right eye, so those are correct. And then I have his insulin, 14 and 6, which is 20, and I have that one right here. And then I have his haloperidol lactate of intramuscular, and I have my calculation here of 0.5, and that is also correct. So I will walk into Mr. Underwood's room. Hey, Mr. Underwood, how are you today? And I'll provide the patient with privacy, and I will perform hand hygiene. How are you doing today? So I'm here to administer some medications. I'll apply some gloves. Okay. Could you tell me your first and last name and your date of birth, please? Okay, and so Mr. Underwood tells me his first and last name. And then, do you have any allergies? Okay, and he did tell me these are his allergies, and none of these are the medications that I will be administrating. So first, are you able to swallow? Okay, he said yes, and we can ask them to swallow some of their own spit. Next, have you had any recent eye surgeries or ear surgeries? Okay, he has not. So first, before I administer his medication, I will recheck it one more time at the bedside. Amoxicillin, I have my conversion right here, my calculation, 10 milliliters. Okay, so could you please swallow this for me? Okay, so I give it to him, and then I ask him to open his mouth to make sure he swallowed this one, and I would disregard this one. Next, I'm checking, I will do his drops in his right ear, and I'm checking it one more time. Afloxacin, 0.3%, 4 drops in the right ear. Also, I will make sure to document that I gave him his amoxicillin. So I would document that. And then this one, like I said, afloxacin, 0.3%, 4 drops in the right ear. So we would help the patient adjust. Okay, so take the lid off. You would pull the peanut up and back, and you would do 4 drops. 1, 2, 3, 4. Okay, and then you massage the tragus, and you put the cotton ball right here to prevent any of the medication to come out. And then you ask them to flip back over. Next, I will be doing pilocarpine 4%, and this one is going in the right eye. Okay, and I will only be doing 1 drop of this one. And for this one, with my non-dominant hand, I will open his eye and drop 1 drop in his eye, and then close it, and then with my cotton ball, I would do this for any excess. Okay, and then I would disregard these and get rid of these. And I would document this one as well, saying that I have gave this medication to him. Okay, next I'm going to do the intramuscular injection. So I have it right here. I'm checking it one more time, and it's right here. Let's see, intramuscular. Okay, so it's haloperidol lactate 2.5. I have my calculation right here. And so for this one, we would do it on the ventrogluteal location, which is right here. So we find this area, we place our hand like this, like in a V, and we would go straight here. So for the video, we will be doing it on this one right here, but that is where we would normally do it. So first, I will wipe the skin and make sure it is dry before I do anything. So do this in circular motions. We would disregard this, but I will use it for my next one. So I wait for it to dry. We go at a 90-degree angle. Okay. So just like this, we pinch, we go down all the way. The needle has to go all the way in, and slowly administer the medication. All right, we would then pull out quickly and use the scooping method to put this one up. I would disregard this one in my sharps container. Next, I will be doing the insulin, so I'm checking this one more time. So 14 and 6 is 20 units, and that is what I have right here. So this one goes in like your fatty areas, like your love handles, or like your back right here. So for the video, we will be doing it on this one. So once again, I would use a new one, but I will be using the same one for this one. Also, after each injection, we do apply a gauze on there, and if there's any bleeding, and if there is, you would apply a Band-Aid. So I wait for it to dry, and once it is dry, take my cap off, and the same thing. So you pinch, and you go straight in. So straight in, administer it slowly. Okay, I will then put this one back on, and I would disregard this one in the sharps container as well. And afterwards, I would place the gauze right here to make sure there's no bleeding, and if there is, I would place a Band-Aid. So I'm done with this, so I would disregard this. Have a trash can. Put this back. So I would document that these injections have been given, and then I would ask Mr. Underwood, do you need anything else? And I would be back in about 15 to 20 minutes to see if you have any reactions to the medications. Then I would throw my gloves away and do hand hygiene as I am leaving. And that is it for my video. Thank you.